When I talk about UBodyWork, I often talk about alignments. And these are alignments on 4 different levels that I like to think about. First of all, we have what I call the cellular alignment. So this is alignment on cellular level. If we think of our bodies, we're just basically a mass of cells. And all of these cells are kind of held together, but they're suspended in liquid. And they need to be in a certain position for the cells to function. Yeah? And so alignment of those cells is extremely important. Now those alignments can be changed simply by injury. If you hit the cells, they'll bunch up together and they might stick together. Or if you twist, they might become twisted and stay that way. So if we injure ourselves, maybe we go to the chiropractor and he'll readjust the bone, yeah, and put that in the right position. But there's a whole network of tissue all around that might have changed its form. Yeah, so you might readjust the bone and get it in the right position. But on a cellular level, all that information of the damage of the change is still there because the cells are still in the wrong position. So cellular alignment, going to alignments on that really basic cellular level, is a very, very important part. If the cells are aligned properly, then their metabolism functions correctly as well. They can detox properly, they can absorb substances properly, so the cells themselves are healthy. Yeah, so the next bigger step maybe is looking at alignments of joints. So that's the second part, alignment of joints. We think of the joints, we have the joints in our spine, there's our hips, there's our fingers, so all the joints in our body. It's good that these are correctly aligned, and that's something, that's an aspect maybe of chiropractic that we look at, aligning the joints. That's important because if the alignments there are not correct, well, then the joints, the movements of the joints won't be right, so the angles of movements will be wrong, which can put stresses on the bone, but can also stress the surrounding tissue. Each joint, there's muscles associated with it, there's cartilage, there's ligaments, and if the joints are not positioned correctly, we're stressing those structures as well, which can change the metabolism in those, and that can then lead to disease, of course, of the joint structures, or the muscles holding it. So alignment of the joints is extremely important. The third kind of alignment I address is the alignment of organs. That might sound a little strange, but if we think of our insides, our organs are just basically hanging on connective tissue, and they need to be in the right position to function properly. And again, through trauma, through maybe wrong posture, through other influences from the outside, we change the position of those organs. And if they remain out of position, then they can no longer function properly. Also, a change in position might put tension on the connective tissue that holds the organs. And that connective tissue is full of nerves. So now we're sending nerve signals to the brain that might not need to be there. And that again can affect us in a negative way. So getting good alignment and good position of the organs is really a key factor as well to just releasing stresses from the body. And then the last area of alignment is emotional alignment, of course. Emotional alignment means being in line with yourself, so that you actually feel yourself, you perceive yourself, that the emotions that you have are actually correct and they are actually in relation to reality. Sometimes our emotions get a little bit out of skew, especially if we're stressed and things like that. We tend to overreact to some things, we underreact to other things, and that's not healthy emotional alignment. Remember too, emotions are chemicals, and those chemicals are released in our body, which affect other structures in our body. So it's really important that our emotions are balanced and in alignment with all the other systems and structures in our body. So these are really the 4 alignments that I talk about. So alignment on a cellular level, on a joint level or skeletal level. We have alignment of the organs, and then alignment of our emotions.